The number of family caregivers helping older adults in the United States jumped from 18.2 million in 2011 to 24.1 million in 2022. Nearly a 6 million person increase in just over a decade, according to a peer-reviewed study published in Health Affairs. Most of those new caregivers are adult children, and most of them are figuring it out by accident in the first 30 days after a parent gets a serious diagnosis. There are 5 specific mistakes that show up over and over in that first month. Mistakes that may cost the family money, time, and sometimes the parent's ability to make their own decisions later. Here is what those mistakes are and what to do instead. This video is for educational purposes only. Consult a licensed Medicare advisor or healthcare provider before making decisions. A serious diagnosis does not arrive on a calendar. Alzheimer's, cancer, heart failure, Parkinson's, a stroke. It usually shows up in a 20-minute appointment, in a hallway, or in a phone call from a sibling. According to the peer-reviewed Health Affairs analysis of national survey data, today's family caregivers are not only more numerous than a decade ago, they are also caring for parents with more complex health needs. That means the first 30 days matter more than they used to. Decisions made in shock, or not made at all, quietly lock in worse options for months afterward. The good news: the Mayo Clinic publishes a caregiver stress and action framework that maps almost exactly onto what experienced caregivers wish they had done in their first month. The 5 steps I am about to walk you through are drawn from that Mayo Clinic guidance, from the National Institute on Aging's caregiving resources, and from what every Medicare advisor has seen play out in the families they help. Mistake number 1: walking out of the appointment without the diagnosis in writing. Most families remember about 40% of what was said in a serious diagnosis appointment, and they often disagree on what they heard. What to do instead? Before you leave the office, ask for a written summary of the diagnosis, the ICD-10 code, the proposed treatment plan, and the doctor's recommended next steps. Ask for a copy of any imaging or lab reports. If the diagnosis is life-altering, a second opinion from another specialist may be worth the extra 2 weeks. Many insurers cover it. Mistake number 2: skipping the master list. The single most valuable thing an adult child can build in the first week is a 1-page master list. It covers every prescription, every over-the-counter drug, every supplement, every specialist, and every legal document the parent currently has. Mayo Clinic's caregiver guidance recommends breaking large tasks into smaller pieces. The master list is that. Bring it to every appointment from now on. Mistake number 3: assuming Medicare covers what it does not. This is the most expensive mistake. Original Medicare generally does not cover long-term custodial care. That is help with bathing, dressing, eating, which is what most serious diagnoses eventually require. Medicare Advantage plans may include supplemental benefits. Original Medicare does not. Some parents qualify for Medicare Chronic Care Management Services, the Medicare Annual Wellness Visit Care Planning Benefit, or hospice and palliative coverage that adult children have never heard of. Spend an hour in the first 30 days mapping what the parent's specific plan actually covers, not what you assume. Mistake number 4: missing the 4 legal documents most families need. Mayo Clinic's caregiver framework specifically advises planning and delegating early. In the United States, the 4 documents most families wish they had completed before a crisis are a healthcare proxy, an advance directive, also called a living will, a HIPAA release naming the caregiver, and a durable financial power of attorney. Some of these can be completed without an attorney. Some are state-specific. Ask the parent's primary care office whether they have a social worker or care coordinator who can help. Many do. and the conversation is much easier when the parent is still able to lead it. Mistake number 5. Ignoring caregiver stress signs from day one. Mayo Clinic lists the specific signs of caregiver stress: feeling burdened or worried all the time, sleeping too much or not enough, gaining or losing weight, becoming easily irked or angry, losing interest in activities you used to enjoy. Research suggests caregiver burnout may impair the caregiver's own health and judgment, which then directly impacts the parent. The Mayo Clinic framework recommends building a team early: medical professionals, home care services, physical therapy, and respite options. Do not wait until you are exhausted to ask for help. Now here is the 5-step plan for the first 30 days. Days 1 through 3. Get the diagnosis in writing. Request the written summary, ICD-10 code, and recommended next steps. Decide whether a second opinion is warranted. Days 4 through 10. Build the one-page master list. Medications, supplements, specialists, legal documents, insurance cards. Days 10 through 20. Map the parent's actual Medicare coverage. Identify the gaps. Ask a licensed Medicare advisor about chronic care management, annual wellness visit, care planning, and any supplemental benefits the parent's plan offers. Days 15 through 25. Complete or update the 4 core legal documents: healthcare proxy, advance directive, HIPAA AA release, financial power of attorney. Loop in the parent's primary care office for a social worker referral. Days 25 through 30. Build the caregiving team. Run through Mayo Clinic's caregiver stress signs honestly for yourself. Schedule the first respite. The parent's care holds up only as long as your own health does.
If you are not sure whether your current Medicare Part D plan offers medication therapy management or whether you qualify, the link in the description connects you to a licensed Medicare advisor who can check your specific plan at no cost. I've also linked helpful tools in the description, including a caregiver organizer, a weekly pill organizer, and the book Passages in Caregiving. If this video helped you or someone you love, hit the like button. It helps other seniors find this information. And subscribe to the Longevity Briefing for one new research-backed video every week on senior health and Medicare. See you next week.